Hello everyone, in this video we are going to talk about CPR in pregnancy. Now the CPR is on its own a very big topic and we are not going to discuss about the whole CPR thing in this video, but we are going to discuss about the CPR in the pregnancy. What are the differences? Okay, now CPR in pregnancy is both difficult and different. Why? Because there are maternal changes to the respiratory system, to the cardiovascular system. There is a big gravid uterus inside the abdomen which increases the abdominal pressure, intra-abdominal pressure. So all of these things are important to discuss here. Well, this is a very basic superficial video. I'll try to make a very detailed video later on. Now, what is CPR? First of all, we start with the ABC. So A means airway. So you need to check the pregnant woman who is breathing or not, and the airway is clear or not. So if you go for the CPR routine, big topic, and if you are reading the CPR, first of all there is an airway. You need to check the airway is clear or not. Is there any problem with the airway? You need to make some neck changes, positions to make sure that the airway is clear. So first of all, if the airway is clear, then we check the breathing, if the patient is breathing or not. If the patient is not breathing and airway is clear, then there is an indication to start the CPR. Okay, right? Now, first of all, the position in pregnant woman is different than the adult woman. What is the position? It can be two, flat position or tilted position. So tilted position is important in pregnant women because the gravid uterus has a kind of pressure on the inferior vena cava, which is the blood vessel, is the big blood vessel. Okay, taking the whole venous return inside the cardiac. So it's a very important vessel, and the uterus is compressing that vessel, creating problems. Now, when you do in the flat position, this is going to happen. So what do? You try to do displacement, manual uterine displacement. That means if the uterus is like that, you try to displace the uterus to the left side of the woman so that it relieves the pressure on the inferior vena cava. So you have to do this displacement while you're doing the CPR in a flat position, because if you do that without displacement, there is a problem. The CPR won't be that effective at the end. Now, tilted position is always 15 to 30 degree angle. Okay, now the chest compression, which is the most important part of the CPR, the frequency is 30 chest compression followed by 2 ventilation breaths. Okay, 30 by 2. Now, what is the speed of chest compression, or CC? The speed of the CC should be 100 to 120 per minute. So approximately 2 chest compression per second. 2 chest compression per second. Okay, so you can sort out the rhythm inside your mind and you start doing CPR. Approximately 2 chest compression, effective chest compression per second. Now, okay, so this is what the ratio, 30:2. Now, if the patient is already in the hospital and if the patient has been done the intubation, that means the endotracheal tube intubation, if the tube is in position, then you don't need to follow this rule, 30 by 2. Then the CPR will be asynchronous. Asynchronous means the chest compression will also go ahead along with the ventilation breath, and then the rate of the ventilation breath should be 10 per minute. Okay. Now, defibrillation can be used with the similar setting like adults. I have included some pictures as well. So this is the tilted position where the woman is tilted with the help of the cotton or with the help of the anything, any object here. So it makes the uterus lean towards the left side, relieving the pressure of the inferior vena cava, because the inferior vena cava should be here somewhere. Okay, now this is the position. You have to compress firm of the sternum and not into the heart, because basically what happens with the gravid uterus, it displaces the heart and lungs a little bit. It causes splitting of the diaphragm as well. So you have to press right here. Now the angle should be perpendicular. That means the angle of the CPR should be 90 angle. So for example, this is the body of the woman and CPR should be right forward at 90 angle. Okay. Now the AED, that means the defibrillator pads, the adhesive pads are chosen, they are more preferred over those pedals. But anyway, if you have the AED, you have to use it. So these are the position of the pedals. The one on the right side is here, just below the sternum on the right side. Okay, the left one, left pedal, it should be there where left to the left breast. Okay, so here, right there in the lateral side. So the purpose of position is to have a heart in between them. Okay, so that's why the whole mechanism of the energy happens and the heart comes in between. Now this is all about CPR in pregnancy at this moment. Remember the chest compression, remember the position, and remember that she is pregnant. You must call first of all, then do the help with the CPR to the patient. So we'll go through all this video later on, but so far so now just remember all this. Thank you very much.